Well, whether you have a family or are thinking about soon having kids, fertility is a topic that for many years wasn't always openly discussed, especially for people that may have difficulty getting pregnant. So this Fertility Awareness Week, we wanted to highlight some of the realities that people are facing. Dr. Stephanie Appleby is part of the team at Heartland Fertility here in Manitoba and joins me now. Thank you so much for your time today.
Thanks for having me.
So, Dr. Appleby, for a long time, fertility issues weren't openly talked about. It feels like we are hearing people speak more candidly about it now. How common are fertility issues?
Yeah, great question. And I agree. About 1 in 6 Canadians are affected by infertility. And it seems to be that people are more aware of this issue, and I'm really happy to see that people are seeking care often at an earlier stage.
What do we see here in Manitoba? Are there any notable differences here on the prairie provinces when it comes to family planning and fertility?
I think fertility and infertility is really affecting people across Canada. And what we are noticing is that people have a greater awareness of some of the factors that can affect their fertility, including age, and are seeking care. We've seen a lot of people here at Heartland Fertility asking really good questions. So people are doing some of their own research and then coming to Heartland Fertility to get their questions answered.
What are some of the common misconceptions, speaking of those questions, that you hear when it comes to fertility and infertility, really?
Yeah, one of the most common is that we have all the time in the world. And as healthy as we are, unfortunately, 40 isn't really the new 30 when it comes to our eggs. And so people are actually starting to recognize that and are seeking care at an earlier stage.
Now, this is not just a women's issue. Why is it important that we talk about this out in the open and really highlight it?
Yes, absolutely. And that's one of the greatest things we've seen as well, is the awareness that this is affecting, both partners. The sperm is an important contributing factor to fertility as well. And we're happy to see, both partners really playing a big role in doing these investigations.
Yeah, speaking of, what are some of the highlight, or I guess some of the things that both partners can do when they come to your clinic?
Absolutely. So most people are looking for further investigation. What we'll want to do is, an assessment of somebody's fertility reserve. Often that means doing hormonal assessments, ultrasound assessments, assessments to see if the tubes are open, which most people have never had done before, and of course a semen analysis. So these are very basic investigations that most of the time can lead us towards an answer, even without any advanced reproductive techniques.
And one of the questions I had is, how important is it that people get someone like you or people in your clinic involved early on in the process?
And that really is key. The earlier that we're seeing people, we can work through, the more options. Sometimes it's a surgical intervention. Sometimes it can be as simple as a medicine or a medical intervention. Sometimes it takes, some time to get to the answer. And when we have the ability to see people early, then we can offer them all of those investigations and a much broader set of options.
How do people start the conversation?
People can see their primary care provider, or they can contact Heartland Fertility on their own, and they can ask for an assessment with a fertility specialist who can start all of those investigations for them.
All right, Doctor, I want to thank you so much for your time today.
Thanks so much for having me, and happy Fertility Awareness Week to everyone.